How you doing? Is you doing? Because I'm kind of doing. Alright, I got some coffee and we're going to sit down and yammer about this because I have a painting rocks date with some friends here about 11 o'clock. So, let's talk about this. So, I went to go see the new endocrinologist. He was very foreign. Had a very, very thick accent. Very awesome person. I liked him a lot. It's nice to have an, you know, outside opinions. This is the second endocrinologist I have seen here on this base. The other one moved. He was very, very helpful in a lot of ways, and I'll explain to you why. And I'm playing face Tetris with my window because it keeps every time I move, like the sun, because the sun's coming up. But you ain't here for a weather announcement, so you probably don't care that the sun is coming up, do you? All right. So, you know, the first thing I had gone to him to talk about my iron. I'd gone to him after I found out that my iron was 10.4 to see, you know, what he wanted to do because, you know, my bariatric doctor doesn't want to see me till I get my iron up. My normal doctor doesn't know what to do with me. As far as iron, she's just like, take some iron. And I'm like, I already do. So I thought maybe seeing somebody else, you know, to give me tips or to point me in the right way. And then I was also looking, there's some prescription iron, like more than just the regular. This is ferrous sulfate. So it's just, what they give me is the regular generic, you know, iron. Which, it hurts my stomach. So I was seeing if maybe he would know another iron, prescription iron out there, like Iron Light or, you know, Ferrolite or, you know, one of the other ones that would be better for me to take. So when I went in there and started talking, he's like, I don't deal with vitamins. He's like, I deal strictly with hormones. And I probably should have known that already, but I guess I didn't. I never thought about it because yeah, I didn't think about them only dealing with, you know, just hormones and stuff. So on that note, I have to go see a hematologist. So he's like, the only person I can send you to, you know, I can tell you to go talk to is a hematologist. He's like, but they're going to look at your panel. And here we get into it. All right. So I should have got, what the hell was that? I should have gotten him to give me the numbers, but you know, I was already flustered and trying to figure out what I was trying to say, and he was kind of hard to understand because very, 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 very foreign. And you could definitely tell that he was just trying his best to help me. So I was trying to be an easier patient for him to deal with. So I didn't ask for, well, can you give me those numbers? Can you help me? Like, what were they? So he says that my iron level, my iron panel, because they took a panel, everything was great. Yuki, get out of your crotch, dude. Golly. It's like every time I make a video, she just goes to town. I'm like, what is in there? What is in there that is so interesting? Ooh. I'm here talking. And I look over and she's like head first in her cootie-coo. Nasty. Supposed to get that checked out or something. Gosh. Anyway, so he says that all my panel numbers are great. Except for the ferritin. He said the ferritin is a little low. He said, but it's not even that big of a deal. But I don't think he's bariatric friendly. You know what I'm saying? Like, I don't think he understands much about bariatric surgery. I'm sure that he has not really touched on why ferritin would be that important for a bariatric patient. You know, I think that he's just, I don't think he understood, because he was like, I don't understand why your doctor said, because he was reading my notes, that your doctor said that you had to get your iron up or he wouldn't even talk about having a revision. And I was like, because ferritin is what's important for bariatric patients. And he was like, well, all these other ones are great. So what I'm thinking is that the patches, because it's elemental iron, I'm thinking the patches do well for all the other irons. It just, for me, okay, I'm gonna say that for me, it doesn't do well for my ferritin level. Okay, so I think because he said all of my other numbers came up, and this is something I didn't know because my other doctor, you know, she knows about bariatric surgery, so she told me the number about the ferritin. So all of my other numbers had come up. So I guess the patches do work, but they don't work for my ferritin. So I think that's an important thing too. And, you know, that means I'm not anemic. I just have a problem with that one actual, you know, thing. So I will have to go back to my PCM, and I will have to talk to her about sending me to a hematologist, and we will have to try to figure out another way of getting my levels up. So right now I'm taking, so this is 325 milligrams, and I'm taking 4 of them right now a day. And I'm taking the multivitamin with iron, and I'm still, you know, and I bought some of that Iron Ease, iron melts or easy melts or whatever it was. I'm still waiting for those to come in the mail. And then I'm going to buy some perfect iron that Melanie Slice Thinner takes, because I trust her like no other. So one way or the damn other, this iron's coming up. Like, if I have to like start licking a cast iron, like I'm gonna like that's what I'll do to get my iron up, because I want this revision. Now, another thing that we talked about, sorry, that light is all in my eye, mates, is we talked about, you know, weight loss medication. And, you know, he brought that up first, because my other doctor had talked to me, the doctor I saw before him, the other endocrinologist before she left, had talked to me about weight loss surgery, management, drugs. And at that time, I thought I was having the DS, so I politely declined even going into that, because, well, we'll get into that too. This is going to be a very long one, and I'm, you know, but it's worth it if you want to know what's going on. And my hand's shaking. Stop that. Hold on. I was holding that in one position too long. There. And then I'll give you a Cymbalta update too. Alright, so there we go. Alright. Sorry, my stupid Cymbalta makes my hands kind of numb and weird. I don't like it. So then we started talking about weight loss surgery. Then we started talking about weight loss surgery drugs. Not weight loss surgery drugs. Nirvana, come on now. There we go. Now I can be comfortable. So then we started talking about weight loss medication. And we talked a lot about weight loss medication. And it is not something that would work well for me. He said you might get 5% of your body weight off, which is like 15 pounds. And then once you go off it, because they're not long-term medications, they're short-term medications. And once you go off them, you know, the likelihood that you'll gain double. And also, since I have depression and anxiety, and I have a panic disorder, a lot of those medications can aggravate that. A lot of those medications work by giving you severe diarrhea. I mean, there's a lot of stuff that can go wrong with that kind of medication. And him and I both agreed that that's not the road that I need to go down. You know, 5% of my body weight is not worth it to me for the heart trouble, the other side effects those medications come with. So, you know, we definitely decided that we would not be doing that. So he's like, your surgeon, if he's willing to give you the distal, that is what you need. He's like, you need another malabsorptive procedure. You know, my hormones look great. There is no really good reason other than genetics that my body likes to hold on to fat. And that's what he said to me. He's like, at the end of the day, when, you're winding down at the end of the day, like when everything else has been exhausted, when, we've done every test and, the reason is genetics. He's like, look at your family. How many of your family are overweight? And they all are. There might be 2 or 3 men in my family that are, not overweight at the moment, but for the most part, everybody is pretty much overweight. Some of them, I've told you guys before that a lot of my family already have had gastric bypass or the sleeve. Like it runs really, really high in my family. We love to gain some weight. My brother was probably 450 to 500 pounds when he died. So that is very hard for me. But you can see how genetics plays a part, because my entire family is overweight. Except for the ones that got bariatric surgery. So he is definitely, what he said made a lot of sense to me. It also depressed me because I was hoping that there was something else wrong with me that would be an easier fix, like some kind of hormone or some kind of blood disorder or something that, here, take some pills, or, here, do this, or, some kind of definitive reason why my body does what it does. I think it's very hard for me. And not only that, but he and I talked a lot about fertility, and he's like, there are just some people that are not, their bodies are not created to have children. And he's like, I wouldn't give up, on it as easily as I'm, kind of doing now. He's like, but there are just some women that are not able to have kids. My ovaries work, my eggs work, we've had all those good, happy tests, and I just, at the moment, at 330, I don't have my period, like, at all. My body won't do it. So, that's a hard thing for me. It's a hard thing for me. So, because I talked to him about doing the Clomid, and I talked to him about doing, the progesterone and all that stuff to try to get pregnant. And he's like, if you have to try that hard, it's not meant to be. And that was hard for me too. He's like, you shouldn't force things. He's like, if it's meant to be, it will definitely come to you one way or the other. He's like, but the likelihood of that being healthy at the moment is not. He said, your hip and your back and everything else, trying to get pregnant is the last thing I need to try. So, I agreed. If it is meant to be, it will be meant to be. And if not, I'll just have to spoil my friends' babies that are able to have them. Also, my thyroid, we talked a lot about that. And he's taken me off thyroid medicine. We have been banging my head against the wall for so long about the damn thyroid. He looked through the last 2.5 years of my labs, and on 0.25, I have my shit's been perfect. Like, they even tested my free T3, which whatever the hell that means, because I finally got somebody to test it, and it's good. It's all good. So being on the lowest dose, he's like, you don't even need that anymore. He's like, we'll give you another thyroid level panel in 6 months, but I can tell you right now that that's not doing anything with your gastric bypass anyway, so just take yourself off it. That's one less thing I have to take. He's like, you know, it's not been low in 2.5 years. It's fine. And I said, okay. So no more thyroid medicine for now, anyway, for me. So that's where I'm at, guys. I'll give you a Cymbalta update. So the one thing so far I'm not really enjoying is the fact that it makes my hands kind of feel like they're stiff or heavy. That's what I should put it, that my fingers, not really my hands, but my fingers feel heavy. They feel very, very heavy. Or like swollen, but they're not swollen. They feel weird. And I'm supposed to give it like 2 weeks to see if that subsides, but I'm just wondering if like whatever it's doing is damaging my fingers. I mean, does that make sense? Like, I feel like maybe it might be damaging my phalanges, like, or is that something that, you know, I don't know, but I don't like it. I'm like, I don't need my fingers. So yeah, my hands in the up until the evening. I know my little lips are dry. Up until the evening, I'm having issues with it. Once the pill starts wearing off in the late evening, like my fingers start going back to normal, then I have to take the damn pill again. So I don't know. I don't like it. I'm gonna call my PCM today and see what she says. Like, you know, I don't feel any different pain-wise, so I don't know if it's really doing much for me anyway, besides making my hand feel awful. All right, guys. Other than that, I don't really have any other plan. Just to try to get my iron up, try to go see a hematologist, and then try to see my bariatric surgeon probably in January, because I'm not even going to bother him when I know my iron is low. He's going to be like, I told you I'm not going to do anything until you get your iron where it's supposed to be. I love your beautiful, gorgeous, amazing faces, and I will definitely talk to you very, very soon. Mwah.